Atrial fibrillation is a highly prevalent arrhythmia with a 5-fold increase in stroke. Anticoagulation reduces the risk of an embolic stroke by 60%. However, between 20 and 30% of people with atrial fibrillation remain undiagnosed. This study investigated the role of Fitbit monitors and smartwatches for detecting atrial fibrillation using a novel pulse photoplethysmography algorithm. Over 455 adults with a median age of 47 years old were enrolled, and 12% were aged over 65. Patients with a prior history of atrial fibrillation or a pacemaker or ICD implant were excluded. Individuals with 11 consecutive 5-minute episodes of an irregular heart rhythm detection during rest were invited to schedule visits with a telehealth provider. Eligible individuals were fitted with a 7-day ECG monitor to check for atrial fibrillation. The primary endpoint of the study was to assess the positive predictive value of the first irregular heart rhythm detection and the identification of atrial fibrillation on the prolonged ECG monitor. An irregular heart rhythm detection was identified in 1% of this cohort, which is over 4,000 individuals. However, only 1,057 people could actually be investigated. Atrial fibrillation was present in 340 of these individuals. An irregular heart rhythm detection occurred during ECG monitoring in 225 individuals, of which 98% had concurrent atrial fibrillation. The median AF burden was 7%, and the median duration of the atrial fibrillation was 7 hours. This study shows that wearable devices with a novel software algorithm can reliably facilitate identification of individuals with undiagnosed atrial fibrillation.